Hello, everybody. Thanks for joining us tonight on a very timely topic for most of us on elder care. I know a lot of us have aging parents that every day is a different day for us, and we're trying to figure out how to help them in the best way. So, a few of my friends were talking about this topic and thought we could share best practices from global experts, and we have them today. With us today, and they'll go into a little more detail about their backgrounds. So we have Selena Shaw. Selena built Dacey Daughters into a thriving 13,000 member community for South Asian professionals, navigating the complexities of caring for aging parents. She brings the lived community experience to this panel, the stories, the cultural tensions, and the breakthroughs that come with this journey. Dr. Balu Natarajan is the CMO of Accent Care and a board certified internal medicine and hospice and palliative care. Dr. Natarajan is a recognized expert and educator in hospice and palliative care. He brings clinical depth and compassion to one of the most misunderstood areas of elder care, helping families understand that end-of-life planning is an act of love, not surrender. And Dr. Tapan A. Desai is a pulmonologist in Crown Point, Indiana, and is affiliated with multiple hospitals in the area, including Franciscan Health Crown Point and Franciscan Health Hammond. He received his medical degree from the University of the West Indies Faculty of Medicine and has been in practice for more than 20 years. So today we're going to run through these topics that are on the screen, and we are going to go into a little more detail on the backgrounds of everybody, and they're going to speak to their areas of focus. Feel free to post questions in the chat. I will be monitoring that, and as we go along, be asking those questions. At the end, we'll leave a little extra time to go through questions. So with that, I will hand it over to Balu.
Thank you, Sandesh. I will share my slide here in just a second. Can you see it? All right. Is that visible? Yes? We're good?
Yes.
So for the better part, I think, Sandesh, you proposed this maybe 5 or 6 weeks ago and said, hey, if this is real for me, this might be real for all of you. And most of us on this call are somewhere between mid-40s to about 60, and that means that we have parents or other loved ones that we're responsible for who are in their 70s and 80s and 90s. And nowhere was this more clear than when I got off a plane on Saturday and texted the group that was putting this all together that I had to get my own dad admitted to the hospital. I came off an international trip, went to see him, and he was having trouble breathing after a recent procedure. So the good news, he's home and safe, but it was very real, and it's something that every one of us either is encountering, has encountered, and if not, we need to be prepared to encounter, because we only go in one direction after a certain age. And so as Selena and I a few weeks ago were brainstorming on this topic, shared with her some of the things that is important really to all of us. Everybody here is really driven and focused and wants to do well, and they do the same for their kids, and their parents did the same for them. And so as human beings, what are we looking for? If you ever look at Daniel Pink's book, Drive, it was written many years ago, but what it speaks to still holds true, which is we all want to have mastery, autonomy, and purpose. And so even as we get older, even if we retire from work, we still want to have things that we're really good at. We want to be independent, and we have to have a reason to live. We have to have a purpose of getting out of bed in the morning. And those things are all possible if we are also healthy. So as we go somewhere between the ages of 25 and 35, right, over the next 20 years or so, we are doing those things, getting smarter, getting better at things, being able to establish independence, including financial, right? And then hopefully we're maintaining our health. And then somewhere after that, in 50s, 60s, and 70s, then things start moving in the opposite direction. And so we get some combination of functional decline, cognitive decline, nutritional decline. And when those things happen in combination, well, then the body's really failing, and we wind up having to access healthcare quite a bit. And so at the bottom of the slide, I've listed how American healthcare is built to provision for all this. So you move from independent living, and you can then access things like home health and personal care services. Eventually, you utilize assisted living and then hospice. And certainly, people are able to stay in their own homes if they've got a big enough support system to do this. So, after a conversation that I had with Selena in prep for this, had Gamma make me this slide, and I shared it with her. And Selena said, "That's great if only it was that clean and linear." And so the next slide represents how this really plays out, right? Which is something happens and we wind up maybe having some cognitive issues. And so maybe we're living at home, but maybe we get personal care services. And then maybe we get back to baseline and we're independent. But then maybe we get sick, we get a pneumonia, and then you get home health services. And then you start losing a little bit of weight. And so the majority of American healthcare in the last 5 to 10 years of life is bouncing in and out of healthcare and dwindling down. And eventually, if we're lucky, we have a peaceful death. And so, why we are doing this talk is to help make sense out of this busy vortex and let people know to some degree what you can access, how you can get help, what things to be thinking about. And so Selena will help us with that. And then between Tapan and me, we'll talk about some more tactical things, either in terms of specific healthcare benefits you can access or specific conversations that too many of us avoid but need to stop avoiding. Selena?
Thank you, Balu. Thank you for sharing that very confusing slide, which perfectly illustrates the point, though, that navigating the elder care and aging landscaping is very complex and complicated. I am going to, let's see, yes, all right. So I'm going to talk about, switch this. Okay, so basically picking up where Balu left off. So Balu painted the overall picture, right, for us in terms of what the system looks like today. I'm going to go into greater detail on what it means to navigate this elder care system for South Asian Americans specifically. We're going to talk about what to look for, why it's important, and also where to find resources. And to start, I'm going to talk, I just want to set the context, which is that 100 years ago, there were very few Indian American seniors in the US. And then in the mid 60s, there was a change in the immigration rules, and the doors opened to many more South Asian immigrants. Fast forward to today, that initial wave of immigrants are now in their 80s and 90s, and they're using elder care resources. These are people like my own father-in-law who has had his share of issues that we've been navigating. And then after him, there's all the other later waves of immigrant seniors who have come after them. So whether you're here because your parents are already requiring support or you're here because you want to plan ahead, this is a unique moment for us in the US because the US healthcare and elder care system is seeing large numbers of South Asian American seniors for the first time and trying to figure out how to serve us. And at the same time, our community is trying to navigate the system and figure it out. So you've got both sides trying to figure it out at the same time. And that's what makes this very unique, but it's also a very timely topic for all of us. And it's also why it's important to look at how do we find the right senior care resources for our parents, because in that context, the care system is not designed for immigrant communities, including ours. So for our families, what we need are options that recognize the whole person, which means options that address different dimensions of our parents. Dimensions such as language preferences. The US system obviously defaults to assuming English fluency, which is not always the case for us. And so that's where you want to look for translator services, interpreter services. Dietary patterns is another dimension. US system assumes non-vegetarian diets. However, in India and definitely certain pockets of India, the rates of vegetarianism can be as high as 40%, whereas in the US, the general average vegetarian diets is like 5%. So it can be hard to find those resources unless you're asking for them. And this is something that we navigated with my own father-in-law, who was in rehab for a few weeks, and somebody in the family was bringing him food every single day because there wasn't anything nutritionally adequate for him there. But obviously, it would have been easier if they were able to accommodate. From a spirituality and religious practices standpoint, obviously, the system assumes more of a Christian faith or background. So, for example, if you wanted to see a chaplain, you might be connected to a Christian chaplain. However, there are Hindu spiritual chaplains that are available. You may not know about them. You may need to ask for a resource. Family dynamics, again, the US system assumes it's very patient-centric and it's very much based on nuclear families. And so our families come in and we have multiple people who want to be involved and part of the decision making. It takes some advocating on our part to make sure it happens. From a cultural norm standpoint, some things to look at are from modesty, as an example, trying to have same gender medical care workers for your parents. And this also includes attitudes, right? So, in terms of culturally, how do we look at different types of care? So, for example, with hospice, our community does not enroll in hospice at rates as high as the general population. And some of that is because it requires a reframing that is more palatable in terms of how do we speak to our community and our parents about choices like that, assisted living, all of these things have a cultural component to it that maybe does not in the default US framework. And then from a peer community standpoint, when you're evaluating anything related to a community for a parent, this is where you want to look for things that will support their social, that provides them with that social support with that comes with that shared cultural context and shared cultural memories and values, and really allows them to be themselves. Because ultimately, all these dimensions are about recognizing the whole person in a holistic way, so that way our parents feel seen. And the benefit of this is not just, it's not a feel good, we've got the language and culture match. It goes beyond that. It's actually clinical as well. It leads to better health outcomes. So there have been studies where just matching on language alone, like making sure that you have an option to have an elder care service or caregiver who can connect with you on language, on your language preference, that can lead to improved medication adherence, better blood sugar control, shorter hospital stays, and fewer readmissions. And the reason for this is that when you're able to connect with somebody better, that establishes trust, that leads to better adherence and compliance, both with medication, but as well with exercise regimens, with physical therapy that's been prescribed. And all of those things lead to better health and well-being outcomes. So that's why it's important to look for culturally relevant resources for our parents. Now, where do you find this? So that's why this is actually why I started They See Daughters, because when we were navigating this with my father-in-law, as well as my mom, I lost my father at a young age, and we lost my mother-in-law also at a young age. And so we've been navigating this system for solo aging parents. And there was never like a central community or a central resource to find resources. And so They See Daughters is a way that you can find tailored, culturally tailored resources for South Asian Americans. Some of the top questions that we get are, how do you find an Indian home health aide who speaks Gujarati in Chicago? Or where do you find an Indian senior day center in the DC area? Maybe somebody's looking for an Indian senior living community in Texas or dementia care support in New York City. What all these questions actually have in common is that our families and our community are looking for options that have basically been adapted for our community, right? They're looking for options that align on language, that align on meals, that align on common community and shared experiences. This is why this is important. And for dementia care, there's a lot of stigma with dementia in our community. And so finding dementia care support that actually speaks to the Desi population helps with destigmatizing it and helps with making sure that you have access to translated materials or at least tailored resources. And so if you're looking for options for your parents, this is where I would start because, again, if you can find resources that are tailored culturally and linguistically for your parents, it will lead to a better outcome for you and for your parents. But also, despite the fact that we have dozens of resources in our directory, there are a lot of gaps still. And the reason for that is because even though even though we have lots of resources available, that it's not nearly enough for our community. If you're in a large metro area, you'll probably have some options, but if you're in a smaller city, it is harder to find these tailored options that are available. Same with residential facilities. If you're trying to find an assisted living facility across the US, there are very few that are tailored to the Desi population or even have a Desi wing. And so these resources are hard to find. So in cases where those are not available to you, you want to obviously look at the traditional resources. And for that, you can also talk with your local area agencies on aging. You can talk to a certified senior advisors. Typically, they do consultations for free. And there's also other caregivers, support groups, and communities that you can tap as well. So those are some options for you. But my message is, at least for our parents, if we can find culturally tailored resources, that'll lead to a better result.
Selena, I've got a quick question. As you think about those of us who have two parents around, knock on wood, one is healthier than another. Are there resources to help, I guess, train or educate the one more able parent so they can do a better job of taking care of the one that needs a little more help?
I don't know of any, well, I think it depends on the actual care that's needed. So for certain specialized conditions, those there are organizations that will have helpful materials that are condition specific. I don't know of any that are broad, that be uniform. But I have to also say, we also here in our community, there's a concern when this happens, right? Because it's that second parent that you start worrying about, the one that's taking on all of this. That person is aging as well. And so it's fine, they'll take it on, but at some point it becomes hard for them as well. And so it's important to not solely rely on the other parent.
Great. So I guess Balu will go back to you.
Looks like Neville has his hand up, so I don't know if you
Oh,
want to field that.
yeah. Neville, go ahead, please.
Thanks, guys. Selena, Balu, really appreciate you guys putting in the effort to do this and send us you as well. I have, thankfully, two reasonably healthy parents still living in San Diego, but on occasion, when they do need medical services, it takes them forever to navigate the healthcare system. And so I've advocated, and thankfully they're able to do this, but I've advocated to them a concierge doctor. And they've been resistant, I guess, for whatever reasons, but what would be an amazing service is if there was a directory of South Asian concierge doctors. Are you guys aware of anything like this?
So concierge doctors, yes. Specific South Asian concierge doctors, no. It is something that we need to start looking at more deeply. as an example, right? Selena knows better than any of the rest of us. We now finally have Indian senior living communities, right, that are like tailored to our community. And I think what's going to naturally happen next is then, healthcare that is similar. I will tell you, for my own parents, I did get a concierge doctor for them. And for those who are curious, it can go as high as $30,000 a year, but it can also be anywhere from $1,500 to $3,000 a year. And that's a price point that for a lot of our community is manageable. And for my own dad, he had a kidney transplant 10, 11 years ago. So in his mid 80s, he's still working, still driving, right? So pretty independent, but his health is such that one thing can really throw him off. So I got him a concierge doc last year. And this is a guy who just happens to really appreciate Indians and Asians. So like he will make house calls and then of course he'll be fed when he comes home. So he's thrilled. This doc is, and my parents are thrilled as well. And for me personally, some folks are putting in the chat box just about the caregiver as a physician or health care provider and family member. It's hard to wear both hats at once. And so for me, even though I'm not doing the heavy lifting, taking care of my parents, they still have each other and they're still living independently. Having this doc who was the doc where I could say, hey, this is what I'm seeing or this is what I'm noticing, he'll call me and bounce things off of me, but I'm not having to make the decisions. I have a partner who's driving it, right, with my input. So I think to answer your question, it is something that as a community we need to do. But if we don't have members of our own community as the physicians themselves, still there are many people that are reasonable from a connection or from almost a spiritual connection perspective that are great. And we've been very pleased with what our doc has delivered.
Not a doctor, but if I was, it seems like a good business idea to have a network of Indian concierge doctors because I think there would be a lot of demand for that.
I know that I think it's called South Asian Cares, that was putting together a directory of Indian providers. They're not necessarily concierge, but the idea there was that you could try to filter based on language, based on where you are, the language, insurance type, all those things. And so I think concierge is like a natural next step.
I'm actually curious on this concierge concept for more of the general practitioners, because I assume most of them are general practitioners. I know for radiology, they can moonlight a lot. Can a lot of these general practitioners that are South Asian have a moonlight job where they concierge on the side, or is that not typically allowed?
So the allowance isn't the issue, right? Like what's attractive about the concierge doc is you have your doc rather than having a primary care practice of 2,000 or 3,000 or more patients, right? They'll have a panel of anywhere from 300 to 1,000 patients, and that's it. So access is much more ready, right? And so like unless they're on vacation, like out of the country or something, reachable, right? You can get in with them, they're managing. And so if it's a side gig, then that access, which is one of the most attractive pieces, is lost, right? So you'll get the emotional, spiritual connection of having the Indian, but you won't have the access. And a lot of what gets complicated with this population, healthcare in general, right? But certainly with this population is just fragmented care and handoffs can really be detrimental, especially the sicker and more complex the healthcare is.
Right.
What about incorporating like a telehealth component with doctors from India? If you're just looking for advice or guidance and not US licensed care, that might be a model at a price point with no language barriers that as a community we could tap into.
Something to look at.
I think Swati had a question. Go ahead, Swati.
Hey everyone, can you hear me okay? My concern is that as we talk about concierge medicine, we are excluding a population that may not have access to those financial means, right? And so I feel like if we can solve for access first, then even those who have the financial means will be able to be taken care of. But then if we look at the equity part of it, because there are a lot of families who don't have the means.
That's a good segue, actually. I can now go through both Medicaid and Medicare accessible options for those. It's not the same, right? Medicare hasn't solved for the messy middle. But I think, Sandesh, this would be a good time for me to go through that because Medicare has actually provided a lot of really good resources, right? The handoffs are not clean, but the resources during periods of high intensity are actually pretty amazing. So, Sandesh, maybe we should spend time on those four things and then you can redirect us back to either Tapan or questions or some combination thereof.
I think that sounds good. And I see we've got three questions, which we'll get to right after Balu gets through this. But we certainly, let's see, wow, we got about 20 minutes left. So we'll make sure we get to the other content as well. So I'll paper some of the questions.
Great. So, Swati, to your point, right, there are at least three items. The fourth is not really paid for, but Medicare and Medicaid cover home health. Medicaid in many states covers personal care services. Medicare covers hospice. And so what I'll go through is, okay, under what circumstances do you access these things, right? And then who pays for it? So home health is somewhat finite, right? There's very specific ways that you can access home health. So this is for a specific skilled need after a recent hospitalization, recovering from some surgery or intervention, some chronic illness management. Essentially, there needs to be a skilled nurse need. And at the end of this talk, if you don't know what that is, Rupal Patel will be glad to talk your ear off about what a skilled nurse need exactly is. And Medicare covers home health. The Medicare replacement plans will cover home health for the most part, right? Public aid or Medicaid will typically cover it. And then if you have private insurance, there are private pay options as well. This is in the home, whatever the patient or the client calls home, this is a care that's delivered in that home. So if you live in an assisted living, you live in an independent living, you live in an independent house, right? The care is coming to you. What it doesn't provide is 24/7 care, right? So if somebody has dementia and isn't safe to live alone, home health will not be sufficient. So this is to help that caregiver. Someone gets sent home on IV antibiotics, for example, right? The caregiver isn't stuck having to do that all by themselves. They can get help from a skilled nurse. Then the next is personal care services. This is non-medical. So this is housekeeping, toileting, mobility assistance. So this is non-medical assistance with activities of daily living. This is not covered by Medicare. It is covered by many states' public aid, but this is, again, from an access or equity perspective, if somebody qualifies for Medicaid, depending on the state, some of the more friendly states for this are Texas, California. If folks are veterans, for example, there's a great VA benefit for it. So it's actually something that's really special. And in some places like New York, family caregivers can qualify as the caregiver. And so if they're winding up having to quit their job to take care of the caregiver, they can actually at least get paid to do that, which then is a very nice mitigating factor. So there's no nursing treatment, there's no medical treatment, but you can have home health and personal care services at the same time. The next thing is palliative care. Now, at the moment, there is not a Medicare or Medicaid palliative care benefit in most states. Medicare, there isn't at all. Medicaid, there is in some states, such as California. In the latest proposed home health rule, which came out last month, the final rule will not be published until Q4 of this year. There is a provision for palliative care under the home health benefit. So probably in 2027, even palliative care, which is focusing on symptom relief and some spiritual counseling and family education, but basically helping patients and families navigate the fact that their body is not going to restore, that a lot of this disease is not reversible. So helping to, first of all, understand that, and then secondly, navigate the symptoms and plan for what happens next. So that's going to be part of the home health benefit if all goes well next year. And then finally, hospice. This is for folks who have 6 months or less to live. Now, the reality is at least a third of all patients across all demographics are on hospice for 7 days or less. So almost everybody accesses this too late. And they usually access it, and Tapan will get into this a little bit more, they usually access hospice 2 or 3 hospitalizations too late. So they're spending the last 6 months of their life, 4 or 5 of those months, in and out of the hospital. And then suddenly somebody says, this might not be recoverable. And people then go home and they die on hospice after 7 days or sometimes in. This care, which is terminal care, can be delivered in the home, it can be delivered in the hospital, it can be delivered in a nursing home, it can be delivered in a facility. But the ideal situation is that somebody knows and is informed that they have a prognosis of 6 months or less, optimally close to the 6 month mark, not at the 6 day mark. And when that is offered, when people are truly given the choice, often in our community especially, they say, that's it, I'm done. I don't need all these bells and whistles. Leave me alone, right? I want to actually be at home. And so you can live at home. And so optimally, if we get their symptoms under control, then they can get financial affairs in order if they haven't already. And then the rest of their time is actually a spiritual journey and saying goodbye, which is really the most dignified and most likely situation of having comfort and peace at the end of life. That is covered by Medicare, really with no copay, so it's pretty amazing. It is also covered by many private insurers for those who don't qualify for Medicare or Medicaid. So I'll pause there and give it back to Sandesh, and probably good for Tapan to weigh in at this point.
I guess there was one question that's probably related to what you just shared. Is there a way seniors can find out what local Medicare and Medicaid resources they qualify for?
Yes. What we'll do is I think we're going to give some slides later on, and we'll make sure that there's some links in there for them to be able to.
Okay, got it. And I know folks, we're running out of time and want to make sure we cover all the content. So if you could put your question in the chat and we'll try to weave it into the rest of the discussion or try to address it at the end. Great. Dupin?
I'm right here. I'm trying to figure out how to share my screen. Let me see if I can do that. Sorry about that. I'm not sure if it's going to share.
You
I'm not
have
It's okay. So,
but this is a big topic and probably requires another hour.
in general, this is just a little bit about ICU level care. For at the end of life, we see a lot of majority of our patients that come in end of life issues, especially critical illness. A lot of what afflicts our community, especially our cardiac disease, strokes, pneumonias, and often major trauma. And then navigating mechanical ventilation, dialysis, and continuous monitoring. I think the important things as our parents and our community ages, understanding early recognition, which can improve treatment survival, understanding that 5 to 10% of all hospitalized patients over the age of 70 end up requiring ICU level care. And then elder care in our Indian community, most often they have longstanding diabetes, cardiac disease, and then dementia. The challenges, though, that we see, especially in the South Asian community, at least in and around the Chicagoland area, we're seeing like a lot of language barrier issues that Selena had alluded to earlier, limited health literacy. And then the big one that we see a lot is delayed advanced care planning. So a lot of our parents and especially in my situation, others often are not involved in the advanced care planning. And I think that's an impactful planning sessions that do need to happen for our parents. I think understanding goals of care, which is not discussed in our community very much, and then shared decision making. I think Selena had alluded to culturally competent communication, which I think is extremely important. And I think these are the things that we see in my scope. I'm an acute care physician, and so certainly I see this a lot. But really, that's what I wanted to talk to the panel about mostly. It's just getting on top of it early and having those difficult discussions. In my own life, we didn't do that as early. Alu knows. And it was a bit of a challenge for us at the end. Anyway, Sandesh, thank you for allowing me to speak on those few things.
Great. Thanks, Dupin. So we have about, let's see, I think about 15 minutes left. So we do have some time for Q&A or any other topics on your mind that you would like the panel to talk about. So feel free to jump in.
I have a friend of mine in Wisconsin that shifted her practice to concierge medicine. I can reach out to her and ask her if she would know how to put together a national directory of South Asian providers that do concierge medicine.
I also have some videos that I have started with community research, community education, and I do have videos in Gujarati and English both for palliative and hospice care. So this is mainly focusing on making it understand for the families, the generation that we have right now, they're sometimes not just able to translate everything to their elderly folks, and that just makes that transition a little bit more harder. So these videos are short and they help understand different phases of palliative and hospice care, different levels of care, different diseases, and how it progresses and things like that. And I post them every week. So please feel free to share them. There is no cost to it. It's just for community awareness. I am a hospice nurse and I am in Houston, Texas. I used to be in Chicago, and I do work for Excellent Care under Dr. Natarajan. So I have learned from the best, and I would say I had great mentors throughout the years. So I'm putting out my experience of patient care and how our South Asian community should be supported in getting more knowledge and information so that they can make these decisions early enough. So, thank you.
Hi, I'm Padmaja from Boston. Can you hear me?
Yes.
Sorry, I can't come on video. I'm driving. I wanted to raise the question of mental health needs for the aging population as well. I do not have an answer, but I wanted to bring that question in to find out if any of you have found that out, or how are you navigating it?
So we're not very good at that as a community, right? Like, we don't want to acknowledge mental health. It's physical, it's mental, it's emotional, it's spiritual. That's the totality of health, or at least more of a totality of health than just physical. As a community, we don't like to acknowledge that. And so we don't have great answers for that. I think that one of the things we have to do is just make it safe.
Balu, can you hear me? Oh, sorry about that. I couldn't know if it was on or not. I apologize.
Go ahead, Depan.
I agree with that. Oftentimes we don't have that dedicated team. When you were speaking on that, I don't know, can you allude to that about when patients are in the hospital? Discuss like how they can coordinate those hospice and home care teams, because often those patients are sick. Family members are unable to help to coordinate that. Often, is there any teams or anybody that can reach out to families while they're in the hospital itself?
So that's actually, for us, companies like ours at Accent Care, for example, we do have teams that come to the hospital, whether it's for home health or for hospice. So some of the bigger hospitals will have that. Many communities will have that. Some of the smaller ones will not necessarily. But I think more and more, especially with hospitals kind of being disincentivized from people getting recurrent admissions into the hospital, they are connecting more with community organizations to home care.
Thank you.
I've got a question. Oh, let me ask one question, then we'll go to you, Rita. In terms of our parents traveling back and forth to India, or they're just taking a holiday with their other friends, and how do you manage care when they're outside of the country for extended periods of time?
I don't know if anyone else, Tapan or Selena, you want to weigh in. I can tell you, for me, before my dad's kidney transplant, he was on dialysis. Madhav might appreciate this. My dad was on peritoneal dialysis, which means he had a machine that helped him clear his functionally as a supplemental kidney every night. He has taken this machine with him internationally. He would go to India with this thing, with all the bags and everything, because he refused to not go to all the temples that he wanted to go to every year. That's something that he had done since 1993, and he's like, I'm doing it anyway. He had clients that would go with him and carry all this stuff. And so, like, I would be arranging lab requisitions for him to take with him and then get blood work, and that I was trying to sort that out from here. It helped once my sister-in-law joined the family and her dad was a doc in India. Then I finally started to have some partners out there that could help out. But it's not easy, right? Optimally, knowing, part of it is you need to know how precarious your parents' health is. What are some of the things that they might be dealing with? And then trying to figure out, okay, where are they going? If they're going to a village, it's one plan. If they're going to big cities, then knowing, okay, where would I want them to go in those big cities, depending on what's going on with them. So I think more than anything else, it's planning for it. And then the other is honest conversation, right? Saying, hey, like, depending on, and we at home certainly had these conversations during and after COVID, what countries can you travel to and what countries can you not, right? Like, if you're going to go south of the United States, Costa Rica, probably reasonably safe. Mexico, maybe not so much, right? There's just a lot that goes into it. from a detail perspective beyond the scope of this. But I think more than anything else, proper planning to at least mitigate. It's not optimal, but it at least gives you a chance to vicariously rehearse what are some of the things that could go wrong. You can never plan for all the things, but you can plan for at least some of them.
Yeah. And I've seen, again, a lot of questions going in the other direction with parents from India wanting to visit the US. And so there oftentimes it's in addition to planning for care and what you're going to do, like in the case of dialysis or something like that, it's also, do you have the insurance? Especially when you're coming from India to the US, do you have visitors medical insurance? There are also med back type arrangements to get people transported internationally in an emergency, if they needed it. And so just as part of the planning, think about these contingencies and just make sure that what your options are if you need them.
Got it. Got it. Rita?
Good evening, everybody. Thank you for a wonderful information. Thank you, Salina and Balu and all of you. I think it has been wonderful. We have a group called Friends of Indian Senior Citizen Organization in Boston area. And we've been around for 16 years. And we started these just to bring this community together and bring the seniors out of isolations. And we have a lunch program for $3 in all of our 5 different centers in partnership with the mainstream government called ASAP, and that has been very popular. So I do get a lot of calls from people across the country saying, how can we repeat these in other states? So I would love to see how my knowledge can be transmitted other part of the country and a lot more people can benefit because these 700 members really love this lunch program that they are able to attend different days of the weeks, Monday, Tuesday, Wednesday, in different. It is totally free, like $3. And this is for the people who have worked in this country for 40 years. So we have adult day health program for like people like my parents or in-laws who are dependent upon us. But these are the people who have worked in this country 34 years, 40 years, and they don't have anywhere to go to socialize. If they are working until 70 or 80, then they have a workplace socialization. But if they are retired in 60, 65, they don't have any place. So this is really a wonderful. Check out the website, but I would love to see how we can have a dedicated volunteers across the country and be able to replicate these model because so far it's working for many of our community members.
Great. We have time for one more question and then we'll probably wrap it up. Anybody? Okay,
Hi,
oh,
it
go
is
ahead.
it's Annapurna Pandey from California. It's absolutely very educational. Thank you all for the information and all the wonderful services available for the seniors. I'm curious to find out that because as Selena presented, that it is not just that one way to define the Indian senior because of the language and food and spirituality and so many issues that as the markers of identity. So I was wondering, what is the nature of communal care? Are you all thinking of that? Maybe I was thinking like whether it is the temple service or whether it is the community, whether various regional organizations and other kinds of informal communal care so that where people feel comfortable and people have a sense of support. So I'm just curious to find out more about it.
I think that a lot of that is definitely geographic specific or geography specific in terms of having community.
Very region, that's right.
And so, for example, there's obviously, like Rita mentioned, those are community programs. They're formalized, they're structured, they meet at certain dates and times, and you have somebody else organizing it. But there's also, like in the Bay Area, my aunt goes to a program that all the seniors just come out at like 5 o'clock. And there's dozens of seniors there and they're playing music and nobody's organized it. It's just organic. And I think that is just as great in terms of having those options and seeing that people can coordinate that. And that happens everywhere that I've heard of it in DC metro area as well. I'm sure Chicago, these are things that they happen organically. It's because elders, oftentimes they don't have as many, just so it's a way for them to connect with others of their same age group, and they have similar interests and such. So in terms of finding these community programs, I think it is just going to the temple to see where people hang out, and using your local Indian network to find out about these.
Great. I think we're
Thank you.
great out of time. Thank you, everybody. I'm going to share my screen real quick just so if you want to get in touch with any of us, and there should be the slides going around, you can. But thank you, everybody, for joining our discussion. I thought it was a great discussion. Hopefully, you had a takeaway or two. And we may be doing more of these in the future, depending on interest on different topics, as I'm sure we only scratched the surface here. But thank you, everybody, for joining us, and have a good
And for
evening.
participating. This would have been
Yeah,
so boring if
great.
everyone just sat around, but we ran out of time, right? Which is exactly what we need. We need to advance this conversation. And Sandesh, thanks for triggering this. We'll be back, right? Clearly, we just got started, so we'll be back to continue this conversation.
Can I say one last thing? For those of you who have not read the book Blue Zones, read the book Blue Zones. It's about, I forget the author's name. It's about, he studies 5 different geographies around the world that have the most centennials, so most people living over 100. And the one commonality across all 5 of those is community. And as South Asians, that's the one thing that we absolutely do have. And so we need to reinforce that.
If only we had the diet to accompany that.
Right.
In some cases,
Thank you,
genes,
Navya.
right? Great.
Thank you, Sandesh.
Thanks,
Thank you,
everybody.
Navya.
Thank
Bye.
you, everyone.
Thank
Bye.
you.
Appreciate it.
Great presentation.
Bye.